In November 1994, Ken Schwartz, a lawyer, activist, husband, and father, was diagnosed with lung cancer. 10 months later, after a courageous battle, he died. Before his death, Ken laid the groundwork for a center dedicated to improving relations between caregivers and patients.
What am I going to do with the time that I've left, assuming that it's foreshortened? And I decided one way to transform this horrific incident into something constructive was to write about my experience. The ordeal has been punctuated by moments of exquisite compassion. I have been the recipient of an extraordinary array of human and humane responses to my plight. These acts of kindness, the simple human touch from my caregivers, have made the unbearable bearable.
Ken saw and understood what was so important in healthcare, that connection between a patient and a caregiver. He understood that in a way that really very few patients are able to get and very few doctors are able to see. And over the last 15 years, we've worked hard to support that vision and to support and enhance that interaction between patient and caregiver in a way that I think Ken would be very proud of.
They brought the mom to the operating room, did a stat C-section, got the baby out as fast as possible, and out emerged a limp blue baby with APGARs of 0 who did not respond to pain, made no respiratory efforts, I think you're then in a dilemma.
We really thought there was no hope here. The baby, you know, this was going to be, we're going to call the code at 15, and we did our best. And at 14 minutes, I felt for the heart rate, and there it was. Then you're worried about, you know, how much damage has been done and what's happened and what's going on and what did we do, you know? Was this the right choice to have done what we did? I turned around and thought, but at least Mom's going to be able to see this baby. We saved this baby for Mom to hold a live, warm, heart-beating baby to say goodbye. And so leaving my shift that day was a feeling of, I did do something good in a time where it's really bad, you know?
What struck me so much about the rounds is when I visited other hospitals and I saw how universal the need was among caregivers to talk about what it's like to be on that side of the interaction. And you saw that whether you were at an academic hospital or a community hospital, whether you were a third-year physician or a 30th-year physician, whether you were a nurse, a social worker, or a secretary, that the work we do requires a place to put some of this, a place to be able to talk about what it's like to be touched by people every day.
I first met the Zucker family in the fall of 2003, and it was a busy day at the clinic, and we generally walk in and see new patients with lung cancer. And it's a hard diagnosis, it's a hard disease to treat. Michael wanted to make sure that when his time had ended, that he had peace and he was not in pain and that he was able to be with his family. And in the end, that's what happened. Michael, he died at home, his 2 sons and his wife.
When I read that, Ken Schwartz said that the book used to be that doctors and patients weren't supposed to get emotional with each other and emotionally involved, and his feeling was, then the book needs to be rewritten. That touched my heart.
You know what? You made a difference, and we love you for it, and you are a member of our family, always.
And I think that's one thing that the Schwartz Center has learned and has taught others, is that for so long we always felt that compassion was innate, and that the ability to connect to a patient was something you either had or didn't have. And that's wrong. Just like any other skill in medicine, communication and connection absolutely can be taught and it can be role modeled.
The words respect and empathy define certified nursing assistant Alex Lewis.
He's probably the kindest, most compassionate, giving, loving person I think I've ever worked with.
Alex was a civil engineer in Haiti and even worked on a project for the World Bank. But he didn't feel useful. He found his true calling working with Alzheimer's patients at Mary Immaculate Healthcare in Lawrence.
Sometimes, you know, when you're dancing with them, you want to see their eyes to see, you know, the smile, the joy they got in their face.
It's almost sacred Because I've seen people who you first meet them, you say, hello, I'm here to take care of you, you sit down, you start talking, and at first you can tell they're being very superficial. And then something starts to happen. They start to realize that it's more than just a doctor talking to a person with a disease. It's a person, another person, relating to another person.
I've had Lou Gehrig's for the last going on 15 years. She has such compassion, and she believes you, she validates your pain. I really love her, and I've been really lucky to find her because I've had such a bad time.
I think I would remind caregivers that, that patients are strangers in a strange land, and that they are surrounded by equipment that looks odd and by people who are providing care who speak a different language. It is an awesome and intimidating and frightening experience to be a patient, and that it's our responsibility to see patients through it safely, compassionately, and to always put ourselves on the other side of the Johnny, as it were.